Okay, so this chapter, we talked a lot about bacteria in a sense. Hey, this is what they look like. These are the structures that you find on the cell wall. What we really haven't mentioned is how do bacteria interact with humans? And again, before we get to diseases, I want you to have a sense of what goes on. All right? So, let's go for it. This chapter 20 is on infection and disease. I want to go through a few terms with you, and some of them are clinical. You hear them in the clinic or the hospital. I want you to remember them, all right? Okay. So imagine, in fact, just now a case was brought up where we had a spore in a wound. So how does that spore interact with the human? Well, if the spore has nutrients, it's going to germinate. And you know, if it's something like a typical organism, let's say Bacillus subtilis, doesn't cause disease. But if it's Clostridium tetani, it does cause disease. So different organisms interact with humans very differently. Some are pathogenic, some are mildly pathogenic, some would even cause problems at all right? So these interactions that we have between humans and microorganisms, they can be summarized in terms of symbiosis. So symbiosis is basically an interaction or relationship between two organisms. In this case, what we're looking at, you and microorganisms. And here's the thing, there's a competition for supremacy. If one wins over the other, then they take off and they replicate their numbers. For example, if the bacterial cell wins Clostridium tetani, if it starts growing, it starts producing toxins, and then it wins that battle, all right? Meanwhile, you're also fighting against that pathogen. So how do we describe these symbiosis? Well, there are three major types of symbiosis I want to refer to. The first type is called mutualism. So when things are mutual, everybody benefits, right? In this case, for bacteria and the human host, mutualistic interactions occur like this. The bacteria is present, and they're doing something for you. And a good example, I will test you on this, but E. coli, for example, can produce vitamin K. You can't make that, but the bacteria cell does that for you. So in this case, in a mutualistic relationship, both you and the microorganism actually benefits. As another good example, I do want you to remember this one. So the other example would be lactobacillus. All right, so I'm going to name some names and I'm going to ask you to remember. So I'm going to focus on this one right over here, lactobacillus. Lactobacillus, and put a mark on this one, you probably see it again, maybe on a quiz or an exam. All right? Lactobacillus is a gram-positive rod. I don't care that you know that part. But basically, it resides as normal flora in the vaginal tract. And that's really important. So it's in the vaginal tract. And here's why it's so important. That organism produces acid. That acid stabilizes the microflora in the vaginal tract. When the numbers of lactobacillus dips, you have very few. Basically, you have less acid. Potential pathogens don't start taking over. You might have a yeast infection, all right, like caused by Candida albicans. So a very good example, in fact, this is probably the best example so far that we're studying of mutualism, where both benefit, is lactobacillus in the vaginal tract. The female provides a home for this organism. The organism produces low acid, in other words, a pretty acidic environment, actually low pH, a pretty acidic environment that prevents the growth of potential pathogens, all right? In a commensalistic relationship, the micro benefits because you're providing a home for that microorganism, but it's not doing anything for you. It's not causing you harm. It's not causing you good. So there's not a benefit in having that organism at that site. Now, of course, what we care about is this other form of symbiosis. This is parasitism. Now, think about the term. You're a parasite, all right? Basically, you're using me for something that you want. So again, in the worst case scenario when it comes to interactions between microorganisms is this one here. And in fact, all the diseases we'll be looking at, basically those are cases of parasitism. So I know when you think parasites, you're probably thinking worms, but that's, generally that's true clinically. But a parasite simply is this. It's anything that can cause harm to your body, all right? Now, different organisms have different levels of virulence. Not all parasites can do the same bad thing, all right? Some of them have different levels. You might have a mild infection, mild disease. You can have a superbug causing you some terrible problems. Don't ever think all parasites can cause the same type of disease. Here's the reason why. We have different levels of pathogenicity. So the reason why is because they have different levels of degrees of virulence. So again, let's use this one that we used before. The one that causes tetanus, Clostridium tetani. Does that organism cause such a vicious disease? Tetanus, which can lead to death. And then something as simple as an E. coli infection, urinary tract infection, for example, is not as lethal as you would find for tetanus. The reason why is because they have different levels of virulence. What virulence is, it's a degree of pathogenicity. Not all organisms have the same level of pathogenicity. So the next question you might ask, well, why do they have different levels of virulence? Here's why. If you go to their chromosomes, so here's their DNA, all right, this is the DNA for the bacterium. Here's the bacterial cell. You actually go to chunks of DNA. There are areas on the DNA that we call pathogenicity islands. All that means there are genes here that code for many different toxins, all right? So again, the reason why different organisms have different levels of pathogenicity is because they have different genetic systems. These are organized into pathogenicity islands that code for different virulence factors. Not every single organism codes for the same amount of toxins. So the degree of variance of pathogenicity reflects their virulence. Right? Now, some other terms for you. An exogenous infection, exo means without or outside. Basically, this infection arises from something outside of your body. Say, for example, COVID-19. You breathe in respiratory droplets. Well, that wasn't in you to begin with. You got that from an exogenous source. So this is something that you take into your body. It breaches the external defenses. For example, your eye, mucous membrane, the nose, gets into your system to now infect and then cause disease. So exogenous, the pathogen is coming from outside of your body. All right? Organisms can also be endogenous. In other words, this is inside of your body. Endo means inside. So there are sometimes when organisms, think about yeast infections in females, that's caused by an organism called Candida albicans. If things go wrong, the normal flora depresses or whatever, then that organism can pick up. That's from an endogenous source. It's from within the body itself. Usually endogenous infections are opportunistic infections. All right, so go for it.
Dr. Badeschi, what are the three types of symbiosis?
Yeah, so we have mutualism, all right? Then you have commensalism, and the one that we're going to be attacking for the rest of the semester is parasitism. This is a negative consequence of symbiosis. All right? Say that again, I'm sorry.
Well, I was saying I understand. Thank you.
All right, cool. Now we're looking at how do we actually acquire those organisms, those parasites? Well, it can come from outside. That would be an exogenous infection. We can actually acquire it. In fact, we don't have to acquire it. It's already in our body. So just things go bad, things that are normal flora, normal microbiome as we call it, it belongs to you, right? Can now cause disease. These organisms are called opportunistic pathogens. They cause opportunistic infections. All that means is that your body is in the right immune state for something that already exists in you to cause disease. So again, those are opportunistic infections. All right, infections can be primary. So basically this occurs in an ordinarily or otherwise healthy individual. So again, the individual is not immunocompromised. Think about strep throat. Somebody gets strep throat, well, they were healthy before, and now they have a disease. So that's a primary infection. A secondary infection works like this, and I'll give you COVID again, COVID-19. Someone gets COVID-19, basically that's a bad situation. What happens, that's a primary infection. This is the first time you have that disease. The primary agent is COVID-19. And then somebody dies because of this. Usually here's what happens, the virus itself is not killing the individual, but because it weakens the immune system, something else picks up. So there's something in the lung, maybe it's a bacteria, typically they're bacterial infections, they now take over. That is a secondary infection. Diseases can be local. So local is restricted to a certain area. Think about you have a cut. I have some soil getting into the cut, spores of, say, Bacillus germinates, now you end up with anthrax, or spores of Clostridium tetani enters that wound, and now you have tetanus, right? So again, it started with a local site, a local wound infection. It can be systemic. So in the case for systemic disease, here's what happens. Basically, at some point, that organism gets into the bloodstream. And from the bloodstream, of course, it goes to different sites. So once you get into the bloodstream, it disseminates. Disseminates means to move to different sites. It can go to organs, it can go to the central nervous system, it can go to the liver, or wherever. So usually you start with a local disease, and that bacteria enters, say, capillaries. From the capillaries, it goes to the bloodstream, and from the bloodstream, it goes all over. Right? Again, this is a concept map again. Organisms that can be potentially pathogenic, infect you, they colonize you. In other words, they kind of adapt to your system. Now it becomes part of your microbiota. Remember, microbiota is just normal flora. All right? If it causes disease, that means the infection will lead to disease. This is one route that organism can take. Of course, if you have disease, that pathogen can be eliminated. So basically, your immune system wiped it out, or it can hang around your system for a long time to cause chronic diseases. Or in the worst case scenario, that organism can kill the host. Right? Some diseases are communicable. In other words, they can be transmitted from one individual to another in a population. That's a communicable disease. Other diseases are not communicable. Think about tetanus. You can't communicate or you can't transfer tetanus that you have to another person. That's caused by a toxin. Tetanus is caused by a toxin. Diseases can be transmitted by several ways. Direct contact. So with direct contact, you're in close personal contact with someone else. So communicable diseases can be transmitted that way. Or indirect. So typically, indirect contact involves fomites. So here's a word we're going to see occasionally as we go through the rest of the semester. What a fomite is, it's an inanimate object. So direct contact, you're contacting contacting an infected person, you get infected now. If it's through an indirect mode, basically, this involves fomites, maybe a door handle, for example. Maybe the mat or a rug that contains spores of fungi could cause something called athlete's foot, or what we call ringworm or tinian, all right? Okay, horizontal transmission. And again, these are just terminologies I'm trying to get through today in this chapter. Horizontal transmission occurs from one individual to the next. It can also occur from animals to humans. That's horizontal, all right? So here's individual X, here's individual X, here's individual Y. One transfers one to the other. So this is termed a horizontal transfer. Vertical transmission, that's a special term. Here's a mother, all right? And here's the fetus. Basically, there's a pathogen in the mother's bloodstream, passes through the placenta, enters the fetus. This is an example of vertical transmission. It goes up the chain. So horizontal, this is like your x-axis. Vertical is your y-axis. Horizontal transmission, you get disease from other individuals around you, or even from animals. That's a horizontal route. Vertical transmission is a very special condition where mothers can transmit diseases to their fetuses, or to their baby through breast milk, for example. That's horizontal transfer. Right? Now, how do organisms enter your system? Well, we have a special term for it. This is called a portal of entry. Right over here, portal of entry. Now, think about this. This is quite obvious. And I'll give you some examples. It can enter through the eye, the nose, the mouth, the anus, the reproductive system, skin, blood, to the air. Let me give you an example. Malaria. Malaria is transmitted by mosquitoes. A mosquito bites an individual. That parasite gets into the bloodstream. So now you have a portal of entry. All right? Think about COVID-19 and respiratory diseases. You're breathing in air particles or respiratory droplet that contain the pathogen. And that pathogen ends up in the pharynx. It might go to the deep lung. And now an individual might have pneumonia. So there are different sites on the body by which pathogens can enter. All those sites are called portals of entry. All right? Okay, so another thing that leads to disease is, or how rapidly disease progresses, is the infectious dose. Now, we talked about this last time. If you have one or two cells, you probably wouldn't have disease. You don't have the right numbers of organs. There's something called an infectious dose. All this means is the number of pathogens or microorganisms that enters your body through these portals of entry. So again, if I have 100 million organisms, say for example, like with cholera, people drink contaminated water. Well, in that river water or whatever, you have 100 million bacterial cells. You drink it, well, that's a pretty high dose, right?